We're continuing our spring screening series with a spotlight at Fairfax Radiology Centers, and today I'm joined by Dr. Patrick Oliverio to discuss ambient MRIs. First of all, thanks for being here today.
Thank you.
Let's talk about the differences here, first off, between a traditional MRI and this ambient MRI.
Okay, so an MRI, many patients are familiar with. Many people have had MRIs in the past, and the MRI instrument is a machine with a tube that people go in. Over time, the newer machines have a wider bore or wider opening to make people more comfortable. The ambient MRI sort of takes the patient comfort to the next level.
Gotcha.
So the machine is the same, it's the environment and the room are enhanced. When the patient goes for the ambient MRI, when they come into the room, they can pick the color of the background the room is going to become with LED lighting. They have a plethora of choices of videos that they can pick, be they scenes of the ocean or panda bears, or it'll make an environment around them as if they're in a forest. It'll make noises and it sounds to make them feel more comfortable. The machines have enhanced airflow inside them, and it gives it a more relaxed environment for the patient.
Less clinical, more spa-like. Let's go down that road. What does the MRI diagnose? Obviously, it's an important tool.
So MRI has become the primary means to diagnose conditions of the brain, the spine, the head and neck, as well as orthopedic injuries of the bones and joints, ligaments throughout the body, soft tissues in the body, as well as the breast and the solid organs in the abdomen and pelvis.
So it does a lot. Obviously, it covers a lot of body parts there. No pain involved. MRI does not hurt.
There's no pain involved in MRI.
So maybe the only thing holding someone back would be somewhat of that fear. So who might be a good candidate for the ambient MRI? Someone that has a little bit of intrepidation?
Well, it's certainly good for that. It's very good for younger children that are older than would be needing sedation, but still young and can be somewhat intimidated by being in the machine. It's good for people that have some claustrophobia or feel that they might have claustrophobia. It's good for people that are just apprehensive about their diagnosis, and it makes the whole environment less threatening to them.
So can you describe the process of what happens during that ambient MRI?
So the patient is brought into the room just like a traditional MRI, but they get to pick the color that the room is going to assume. They can pick a various video to watch, from animal scenes to mountain scenes to relaxing scenes. There are sounds or music that help them relax. The machines now have more airflow within them so the patients don't get hot, and people in general feel much more comfortable when they're in the machine.
Which brings us to an interesting point. Do you get better imagery when the patients are relaxed?
You actually do, because the MRI depends on the patient holding very still. So the more relaxed the people are, the easier it is for them to hold still, which makes the exam of higher quality and also oftentimes quicker because no images have to be repeated.
Okay, so there's obviously some pretty good benefits there to being calm and being still. Who then interprets the imagery?
So the MRIs are read by a radiologist, and the radiologist that reads a particular exam will be a subspecialty radiologist depending on what part of the body was examined.
Okay, and then pass it on to the doctor that then will work through the process.
That's correct.
Okay, all right, Dr. Patrick Oliverio, thank you so much talking about our screening. This is from Fairfax Radiology Centers. Thanks so much for being here today. Hopefully learning about this new technique, procedure, open your eyes and hopefully keep you from not getting that MRI if your doctor prescribes one.